terms of the waiting list for addiction treatment?
Where I work, maybe 1 to 2 weeks.
I was going to say probably longer in London.
With UKAT, if someone calls our admissions team, which is already free advice, they get seen straight away. Yes, hi, welcome guys, hi. So I'm speaking with Eva Contractor and Sagar Sharma today. They both work for the NHS. Do you guys want to tell us a little bit about your role?
Yeah, so as you said, my name is Eva. I work for the Royal Free Hospital in London and I am a physician associate in urology. So essentially I work as part of the medical team, but I'm not a doctor.
My name's Sagar Sharma. I work as a junior doctor at the University Hospitals of Leicester, currently working in acute medicine.
Obviously, as you know, I am from UKAT, so I'm sat down with you guys today. And UKAT is one of the leading, if not the leading, UK addiction treatment here in England, obviously given by the name. So we are essentially about to sit down and just talk about addiction as a whole and what you guys see from your standpoint working within the NHS, because alcohol is a very casual factor for many medical conditions and issues, including cancer, liver failure, of course addiction, which all inevitably can lead to death. So how do you guys recognise that when patients get admitted?
So obviously for Sagar it's different because he deals with the acute medical side, so he probably sees a lot more. But for most of us, we see so for alcohol, we would see them presenting with withdrawal symptoms. So it's usually at that point that they present, or they present with a different medical condition that's unrelated, but at the same time, they will have withdrawals and then you end up sort of going down that route at the same time. Or they end up being admitted with complications of alcoholic liver disease.
So in my experience, so working in acute medicine, so what acute medicine first is where you see patients right when they're referred from an A&E team to our medical team. So we often see a lot of patients presenting with overdoses. So overdoses related to alcohol, related to multiple drugs, related to other medications. And often when we see these patients, they're not patients that have just come in once. We often see patients repeatedly attend. That's how it comes to your mind. Could this patient be an addict, for example? And then certain things in their medical history make it more apparent. So if somebody, for example, is on a medication called methadone, if you're on methadone, essentially, you may have been a heroin addict in the past. So in different contrasts, we see it differently.
And does this shape the way you approach the patient? Because I imagine there's so many medications that you guys can use, and ethanol might be something that you have to use within your day-to-day with regular admission, like the average patient. How do you go about the different medications and what you're allowed to do, what you're not allowed to do when someone does have an addiction, not just for alcohol, but any sort of substance?
Firstly, thinking about the substances, obviously medications interact and treatments interact with various things. So if you know somebody's, for example, an addict to alcohol, there are certain antibiotics you can't prescribe, thus limiting your treatments. There are certain conditions they may have as a result of addiction as well. So for example, you mentioned liver failure. If patients have advanced liver failure, there are some medications you can't use. So some antipsychotic medications, some antidepressants, some antibiotics you can't use. It does limit things.
Addiction is such a widespread issue, but not so widely spoken about, which again brings me back to the NHS in general, because they have got a lack of funding is already an issue for you guys, which I'm sure is quite a subject that you guys have spoken about with your colleagues, with yourself, what you thought about in terms of how you've managed to get to the position that you guys are in now. It must be quite a frustrating thing for you guys individually as well as for your fellow colleagues in the NHS. But how much money realistically goes behind the treatment of addiction overall for NHS? Do they really focus on addiction? Do they focus on people with drug issues and alcohol issues when they come to the NHS?
The brutal answer to that is no. Because there's barely funding to treat the important conditions. And this is very important as well, but they focus on people who, how do we put this? On people who have not contributed to their disease, if that makes sense. So if you have an alcohol addiction, for example, you're not going to be prioritized from that perspective because there's just not enough funding. And I assume that in the NHS, there aren't really rehab programs because of that.
Exactly as Eva said, it unfortunately, addiction is a medical illness, and we know about it. But there are certain treatments and funding that you may not be eligible for if you're an addict of certain sorts. So, for example, I work a lot with kidney transplant patients, and in any transplant medicine, if you're an addict to any substances, you're not eligible for transplants. So, for example, if you needed an urgent kidney transplant, liver transplant, heart transplant, you simply would not be eligible for those treatments.
I was going to add to that actually, because you were talking about like transplants, and in patients with alcoholic liver disease who reach end stage, the answer is to do a liver transplant, right? Because you need a new liver. But those people will not be eligible unless they've been alcohol free for a year. So already, if you're not, which a lot of people will not be, right? Because they're struggling. So you end up in a difficult situation.
Addict themselves, what would give them that boost to go and seek help then? Because if you're saying that they're going to be last on the list or they need to be alcohol free for a year, some people can't even get through the day alcohol free or even substance free. So what, in your professional opinion, what could be the benefits, rather than quite an extreme example of like a kidney transplant or a liver transplant or so forth? What would be the overall outcome and benefits for someone to become clean?
I guess it overall improves your health, improves both all your mental health, your physical health, your emotional health, and often what I experience from patients who are addicts, again using the term with a bit of caution, is that they often have this mental cloud over them where they just can't think straight. So unless they either are under the substance or under the what you call being high or having alcohol, being drunk or so they can't use their minds, and often you need that clear thought process by which to make these decisions. But again, it would just clear your mind, and it just provides benefits in many, many health conditions.
And not just for the patients themselves, but overall, if you're treating these people how they should be treated and getting over the addiction, but being able to address it, it would actually boost the economy a lot, because those people are usually at the point where they are entering hospital. They're not able to work. They haven't worked for many years. They've completely lost their relationships or support networks. And actually you end up not only treating the addiction if they even get to that point, you're also treating a lot of underlying mental health. Because they're not working, they are therefore having to be supported by the system, right? So actually, obviously there's patient benefits, but there's overall benefits as well.
For the treatment of diabetes, they've approved weight loss injections, and there's a big talk about putting out these weight loss injections to people on benefits
Are you talking about Ozempic in particular? Yeah. Okay.
That also needs to be looked at. Again, with addictions, you're off work, like Eva said, you're not contributing to the economy. Again, that creates a negative view, so there would be a huge economic benefit.
Yeah, that's all very, very valid points, and one that not many people look at, because they, as most people do, it's very human instinct to think of me, myself and I, or my family and loved ones, and that's all I care about, very closed off. But in the grand scheme of it, addiction overall is a very widespread issue that does affect the economy as well, and affects not just the individual, but it also kind of ricochets onto the family members too, because it can cause dependency in enabling, it can cause stress, depression in others, not just the addicts themselves. So it is a very wider issue.
That also needs to be looked at. Again, with addictions, you're off work, like Eva said, you're not contributing to the economy. Again, that creates a negative view, so there would be a huge economic benefit.
And when you guys are obviously in your respective hospitals and you're having an average day, how often do you see a patient admitted with addiction signs or withdrawal signs? Is it a regular occurrence for you guys?
So for me personally, there hasn't been a day I can think where I haven't seen somebody related to addiction. So either somebody who's an alcohol addict or somebody who's taken drugs in the past, and it's very uncommon that I don't see it. And sometimes you can tell by the nature of someone's medical history. If somebody's, for example, allergic to some of the medications we use for alcohol addiction, you can tell that that patient's been an addict in the past because those medications have been tried. So I don't think there's been a day in the last 6 years I've not seen somebody addicted.
I mean, I don't see it every day, but when I do, it has pretty bad outcomes for our patients. So usually what I've seen, and this is probably not a good reflection, sometimes what happens in healthcare, but sometimes what's happened is the patient has come through A&E. Obviously, not everyone is honest about their alcohol intake and things. So then they end up with a different issue. So in my case, because I work in urology, they'll come in with some urology issue, get admitted onto the ward, and then you end up seeing the withdrawals things. So we had a patient who had a seizure because it'd gone unnoticed that they were drinking alcohol. So by the time they got to us, they had the seizure. Then we had to do the whole seizure workup and then realised, okay, actually it's his alcohol intake, and then you go down that pathway. So we see things like that, but also, for example, I had a patient who he was in his 30s, had kidney cancer, but was also a heroin addict, but to the point where he actually didn't receive treatment for his kidney cancer. By the time
he got put low on the list, is that what you're saying?
It wasn't just that he got put low on the list, he wasn't attending his appointments, it got delayed. By the time he came to us, it had spread everywhere. And it was so bad to the point where he wasn't staying in hospital for his treatment. He was leaving the hospital to go and get cocaine. And the thing, not cocaine, sorry, heroin. And the thing is, you can't stop patients from doing that because they have the capacity to make that decision. So that's the kind of things we see.
Fred, obviously I work in the addiction section myself, so I see it a lot, and it's interesting to see it from a different perspective, because it's inevitable that I will see and hear about people with addiction every day due to where I work and the company that I'm so fond of working for. So for you guys to come and essentially show it from your point of view, it just shows that the figures online and the statistics online aren't exaggerated, that they are true, and addiction does affect nearly everyone in some sort of capacity, whether they know someone from work or they have someone that they love or themselves. So yeah, it is quite a striking number. And so obviously you've mentioned about medically dealing with the patients when they come in for something that is not related to their addiction or kind of concurrently relates to their addiction. But how do you go about interacting with the patients themselves? Do you notice you act in a different way? Are you a bit more blunt? Are you stricter with how you deal with those patients, or do you keep the same courtesy, so to speak, to everyone that comes in?
It's always the same courtesy to every patient, but I think we're more aware of how these patients may respond to certain things we say. So often these patients are known to be some of the people who are slightly more aggressive than other patients, or a bit more likely to have altercations with staff, and sometimes it's the patient that you'll go and see which has security around the patient. And obviously there is a reason that nurses or other healthcare members have called security. So while our interactions don't change specifically, you are sometimes a little bit scared or a little bit apprehensive of approaching these patients, and sometimes it can affect the way you think about them. But again, the treatment and the courtesy and the interaction doesn't necessarily change.
That's good. I'm sure that's reassuring to many of our listeners and our watchers today, because it's something that people may be scared. How well equipped do you think the NHS as a body is ready to handle or can handle all of these cases or patients with co-occurring addiction as you're trying to treat them? Because it must make a difficult job that you guys have just that more difficult when you have to go and try and make sure that the issues from withdrawal or previous or if they're currently suffering with addiction, it must make it that much harder. But do you think the NHS is well equipped overall for that?
It's a very difficult question to answer. I think every hospital, every health service around the country is different levels of equipment, but I think while we are equipped, we have shortages in every domain. So, for instance, if a patient with addiction and a patient withdrawing requires more support, they often require one-to-one staffing. When they're acutely agitated or they're acutely withdrawing, that the person requires constant attention, and sometimes that staff member is just not there. We don't have the funding to have that many one-to-ones in the hospital. And other things, for example, where you need more high acuity care, for example, you could do with more doctors around, you could do with more medications. And I don't know whether this was a widespread issue recently, but one of the medications we use for alcohol withdrawal, Pabrinex, had a national shortage. And now the national shortage can only be because it's being used so much or there's no supply, but clearly there was supply-demand mismatch there. So it just shows how bad the problem is.
Do you think that this is where the benefit of private rehab facilities come in? Because you guys mentioned a shortage of just being able to cater to someone with addiction so acutely. Do you think that this is the benefit from rehab, where they can focus on someone individual?
Yes, I would say so, because in the NHS, they will only deal with the acute part of your addiction. So in the case of alcohol, you come in with withdrawal or whatever you've come in with, and then with the withdrawal symptoms. And so you sort of get a detox whilst you're in hospital, but then probably all of patients who suffer from any addiction have underlying like mental health things that require a lot more input than just some medication for a couple of weeks.
So from my perspective, I completely agree with Eva. So as soon as I admit a patient, as soon as I see a patient, the first thing that a manager or higher up a person will ask you is, when is this patient going to be discharged? And that's the first question you get asked, like, what's the estimated length of their stay? And so there's such a focus on discharge in the NHS to try and free up beds for other problems, I don't want to say more significant health problems, but health emergencies that often once they've got over that acute period, there's such a focus on let's get this patient out of hospital that we've not actually been able to solve the underlying issue, which might be a mental health problem, which may be psychological, which may be social, and we've never actually get to the bottom of that problem that may have led to the addiction.
It's such a shame because, for example, with alcohol, it's the third most preventable disease globally, especially within the UK, and you would think that the NHS would put more money behind that, especially if it's preventable, because it's something that people can be essentially not entirely cured from, but something that they can work towards a sober life for, which is obviously good numbers overall for the NHS, because if you look at it from a very broad view, they're going to look at the amount of patients that come in, how many people come back out, so in the broadest of ways. In terms of the waiting list for addiction treatment, because I know you mentioned that it wasn't quite as a popular route that people do go down, but there are options. There are NHS options for free treatment, for free addiction advice and free help, which most people would want to or feel inclined to go to before they start researching their rehab facility options within the country. So you may not know the exact answer, but from your experience, what's the average waiting time for someone from when they first call the NHS addiction treatment section until they get that help, or until they get seen by someone for the initial kind of assessment that is obviously needed when someone goes?
In my experience, really when speaking to patients where I work, maybe 1 to 2 weeks has been, and again, that won't be seeing somebody physically. Often, as a result of the pandemic, we have this new concept of telephone consultations or virtual consultations. And again, in virtual consultations, these patients are quite good at putting themselves together and not being open and as honest about certain things. And you may not find out a full story, but in terms of waiting lists to be seen by these places, probably 1 to 2 weeks in my area. Sometimes if it's specific substances or specific things that are required, it can be as long as a month.
I was going to say probably longer in London from my experience.
That's so long. For example, with UKAT, if someone calls our admissions team, which is already free advice, they get seen straight away. If someone calls someone on the other end, someone who deals with addiction and is a specialist and is part of our team, will answer straight away. And then if they need help, they can get a bed as soon as the next day, depending on who and how needed. That's obviously it is a paid service, so you're getting what you're paying for, but it still shows the drastic difference that you can receive help the very next day if that's something that is a necessity. But if someone's in the same position going down the NHS route, but even a month for that's really long. Even longer, that's
services. Your facility in particular works 24/7, works every day of the week. So often, like the substance misuse services in the NHS don't work weekends, they don't work evenings, and there's often restrictions on these things and getting the help. Often some of these people who are addicts are still working, and they'll be working alongside the substance, and they may not be able to call during work, they may not be able to make these appointments, they may not be able to take time out. They may want to call in the evening and speak to somebody. They may want to speak to somebody at the weekend. And again, that only lengthens things. And then you get questioned as a patient by your employer, why are you taking time off work? Are you unwell? And I don't think patients necessarily want to say, oh, I'm getting addiction help. So that only lengthens the waiting period.
Yeah, the hesitancy, the difficulty in disclosing everything 100% to everyone around you, which is a shame, because most addiction rehab facilities, private ones, including UKAT, is all confidential, and it's very much a question of making sure that the person on the other end of the phone is okay, because sometimes people just call because they're worried about their loved one, and they're just saying, I think this person's, for example, my son is drinking this amount every day. Is this a problem? Sometimes it just takes a reassuring ear. Sometimes it's someone on the other end of the phone saying, actually, that's an issue. That would be classified as an addiction, and then it gets the ball rolling. So, yeah, it's a shame that the NHS services are stretched so thin. But that's where the private rehab facilities like UKAT come in. So, in your professional opinion, or even your personal opinion, what do you think about private rehabilitation facilities?
They're extremely important in healthcare, and I think they play a huge role in getting people back to being sober. And I think it's great that they exist. They really should exist in the NHS. And I think, like we spoke about multiple times, funding, staffing is just not available in the NHS. And I view these facilities with great respect for the work they're doing, with great, just honour that someone is doing the work that the NHS is unable to do. And I think I've seen patients who've gone to these facilities and benefited greatly from these facilities, and they'll tell you that they got the time, they got counsellors, they got a whole team around them, they met other people who were also addicts, they got treated quicker, they didn't experience any of the things that you experience in the NHS, and I think they play a huge role in bringing people back to sobriety and mental and physical health.
Then I agree. The only issue is access to funds, because most of the people, at least that I have seen in hospital who suffer from any addiction, a lot have actually ended up in a situation such as homelessness, and have absolutely no support from family, friends, so therefore, and don't have a job, so don't have any finances that would actually enable them to access a private facility. But otherwise, yeah, I think they are absolutely necessary. Otherwise, I don't know how those patients would actually ever recover.
Yeah, overcome their addiction with that. It's feels very isolating, addiction. It makes people feel that they're entirely alone, and that same can go for mental health issues like depression and anxiety. Everyone, and I've had those initial anxiety bouts as well, where you think, oh no one's going to feel the way I'm feeling at this exact moment in this time. but it's a very universal feeling. Emotions are meant to be felt, and emotions are meant to be dealt with. And some people just need that extra help sorting through the chaos within their mind, or sorting through trauma, PTSD, or depression, because it's no one's fault that people emote the way that they do. It's when people pick up a bottle, or they start using cocaine, or they start using heroin, or MDMA. There's so many different substances out there that people start to use them to felicitate, you know, just not feeling so alone, and perhaps ignoring their feelings, which is obviously is the cycle that leads into one another, and the codependency within the substance and the mental issues overall, which is a shame when people don't get that help from their loved ones and end up on the street, like you said, and so forth. But if people do have the funds, personally, I feel if someone does have the willpower and is determined to overcome their addiction and, you know, make that step to just becoming sober, I do feel that the funds justify the end, if that makes sense, because in the long run you'll end up saving money from not buying alcohol and drugs every day and trying to keep up the rush overall. But I do feel the people that can't access the funds, that's where the NHS should come in, more or less. No, that's I feel it's obviously a big societal issue that we can't, the three of us sat here today, can't overcome and can't solve, but it's something that needs to be spoken about, I feel. And even from the private rehab side of it, I think the importance of discussing addiction overall and making sure that people know that it's not an isolating feeling, or something that just occurs to them in the 1 in 100, because that's not the case. The numbers are very vast, very wide. I feel like we've covered many topics today, but I can't take your time too much. I feel we have a time limit in terms of what we can do, but I really value both of your time. I thank you very much on behalf of UKAT and myself, and I look forward to speaking with you again in the future. Perfect. Thank you so much, guys. It was a pleasure. Thank you.